Welcome to Pain-Free Living. My name is Dr. Andrew Gorecki, physical therapist and owner of Superior Physical Therapy, and today we are talking about all things knee pain. So if you're out there struggling with knee pain and you're looking for a natural solution and you want to avoid injections, medications, and surgery, this is going to be the episode for you. So on today's show, we're going to cover a lot of really valuable information that again is going to help you heal naturally. Some of the things we're going to start off by talking with are really diving deep initially to describe what somebody with knee pain is struggling with, what life is like, and based on all the conversations that I've had with thousands of people in the past 10 years who are struggling with knee pain looking for a natural solution. Then we're going to get into really what the knee is designed to do. You see, we first have to understand what the knee is designed to do before we can understand what goes wrong with it. And then in the next segment, we're going to talk about the two most common diagnoses of knee pain. And we're going to talk about whether those names actually help us understand why the knee is actually hurting itself. And then later in the show, we're going to talk about some studies, some scientific studies that are there to help you make a better decision for your knee pain, to find out whether you should get surgery or not. And then we're going to finish the show up by going through some quick tips that I'm actually going to demonstrate some strategies that you can do in the safety of your own home that'll help you move better, relieve knee pain naturally, so you can return to pain-free living. So I'm super excited for today's show. I'm glad you're joining me. So if you're out there with knee pain, you're looking for a solution that's natural, this is the show for you. And we'll be back in just a minute, so stay tuned. Welcome back to Pain-Free Living. My name is Dr. Andrew Gorecki, physical therapist and owner of Superior Physical Therapy. And again, today we're talking about knee pain. If you're out there struggling with painful knees and you're looking for a natural solution, this is going to be the episode for you. I'm super excited to share with you the knowledge that I've gained over the past 10 years, working with thousands of people, helping them avoid surgery. And so even if you're out there struggling with it and you've been told that surgery is the only answer, I'm going to try to help you make some decisions and find some natural options that may help you avoid a surgery, which I think most of us out there, when we have a choice, and remember surgery is a choice, I think that we oftentimes want to try to do something that's not going to be as high risk and scary maybe as surgery. So let's dive deep first here and just kind of I'm going to describe to you what I hear from many people that are coming in to see me looking for help who have knee pain. And I myself have had knee pain in the past. I've been a knee pain patient. So I can relate. I have a little bit of empathy on how challenging it is and what life is like. So the biggest thing that I notice with most people that come to me with knee pain and are looking for help is that it hurts when they move. That's number one on the list. So that might most commonly includes walking, standing, going up and down stairs, getting in and out of their car, definitely bending and squatting. And so that includes a lot of things like gardening and housework and yard work. Sometimes even your work duties that you have, your job relies on you to be active, and if your knees are hurting you, that becomes really challenging. So I've met a lot of people that aren't able to go to work or had to do a different job because their knees are really just bothering them so much. And so it really affects all aspects of life. And then as we let knee pain continue and it progresses because most knee pain is actually what's called a gradual onset or cumulative trauma injury, which means that our body's not moving so good, and as time goes on, it starts to get a little worn out. And so time goes on, the knee pain gets worse, and what you start to notice is that people are creating a big list of things they can no longer do. You might relate to that. And that looks like, I can't do the yard work anymore. I can't clean my house anymore. I can't do certain work duties. I can't play with my grandkids. I don't like to travel anymore because I'm holding back the group that I'm with because I can't walk for long periods of time. I need to sit down and rest. And so I call that activity avoidance. The activities that we're avoiding become larger and larger. And ultimately what that does to us is that makes us dependent on other people. And so the longer that our knees are hurting, the worse it gets. You become more dependent on the people around you. And that's really just you lose dependence or independence. That becomes a really stressful thing that can start to cause depression, anxiety is oftentimes what I hear from people. And so not a good thing, not a good path to go down. So if you're out there struggling with knee pain, today's episode is going to help you at least understand what all the options are and have a better understanding of what the knee is designed to do, what goes wrong, and then what successful treatment looks like. We're going to talk about a lot of options today that you're going to have. So if you're out there and you've been struggling with knee pain, even if it's been for years, many people that I meet have been struggling for years, don't give up hope. There is hope. There's a lot of things you can do. You might be thinking to yourself, you've tried everything, but I can promise you right now that most people I meet haven't tried everything. And so today on the show, I'm going to try to talk to you about what you haven't tried. And so that's going to be the focus. I would also highlight the biggest thing that I see that kind of scares me with people that are dealing with knee pain. If you have knee pain, you're usually not moving very much, so you're not going to be exercising. When we're not moving very much, now all of a sudden we start to get a high risk for other diseases. And commonly you'll see people, it'll increase your risk for heart disease, diabetes, depression, obesity, and cancer. All of those things are really major life-threatening things that are at a higher risk because we're not exercising, we're not moving as much as we used to. So I want to focus on that. That's really the big driver for me to try to help you today, finding a natural solution to knee pain. So in the next segment, we're going to talk about the first step, which is understanding what the knee is designed to do, and that will help us then understand what goes wrong. So stay tuned. We'll be back right after this. Do your knees hurt when you walk or stand for a long period of time? Have you been told that you are bone on bone and surgery is the only answer? If so, I have a special event I want to invite you to. It's called the free How to Avoid a Knee Replacement Workshop I'm hosting right here in Traverse City, Michigan. Hi, my name is Dr. Andrew Gorecki, physical therapist and knee pain specialist. I'm going to teach you the exact process I've used to help thousands of people avoid a knee replacement. There are only 30 seats available for this free event, so call now to reserve your seat.
I had to come back because of a bad knee. They don't look at the problem, they look at all of you. They give you tools. I now have videos on my smartphone that I open up every day and I can do those exercises.
I'm also giving everyone who attends a free DVD called The Solution to Knee Pain, so call now. Welcome back to Pain-Free Living. My name is Dr. Andrew Gorecki, physical therapist, owner of Superior Physical Therapy, past knee pain sufferer, and knee pain expert, at least as it comes to movement. I'm a movement expert. I can help people return back to moving again pain-free. And I want to teach you today, again, we're talking about knee pain and ways to naturally relieve knee pain. That's the key. I want to help you avoid medications. I want to help you avoid injections. And I really want to help you avoid surgery. I think it's a good thing for us to want to avoid those high-risk procedures with side effects. They're expensive, time-consuming, and oftentimes they don't work out the way we want them to work out. In fact, the last statistic I was just reading in a study shows that about 20% of people that have a knee replacement are still having pain after the knee replacement. So it's not always as good as it may seem for us to just fix the things that we think are going to be fixed by surgery. Okay, so in this segment, I want to share with you a really simplified understanding of what the knee is designed to do, okay? I've spent 16 years of my life studying how the body moves. And so that includes bones and joints and nerves and muscles and all the things and biomechanics. So I want to simplify all that and just really describe to you what the knee is designed to do, okay? So I'm going to have some images show up on the screen here that you can actually see as I'm talking and understand what the knee is doing as I'm explaining it. So one of the rules of thumb when you look at a knee or a joint really is two bones that come together to create a space, and that space is designed for movement. So let's describe what the knee movements are. And it's important to recognize that when you have a joints in the body like to do certain movements and they don't like to do other movements. And usually what they don't do very much of is what they don't like to do. That's going to be important in a minute. So the knee, first of all, it can bend and extend. So you're familiar with that. It does a lot of that. About 140 degrees of bending and extending, okay? And that's useful when you're squatting down to the ground to tie your shoes or walking up and down stairs, anything that requires us to bend and reach down towards the ground. Our knee bends a lot. And so I would say that means that it likes to do that. It's very comfortable bending and extending. Now, The second thing the knee can do, is designed to do, is to move side to side. Now, it doesn't really matter what the name of that is, but the knee can move side to side about 15 to 20 degrees, depending on the type of person. But again, now that's much less than the knee bending and extending, right? 140 degrees versus 15 to 20 degrees. Maybe even 25 in some people. But now it doesn't like to do that as much, but it can do enough. And now the third thing the knee can do is it can rotate in and out, all right? Now it can rotate in and out, but only 5 degrees. Okay, so now that's right there, that's a red flag. That means that if it can only rotate 5 degrees, then we know that it doesn't like to do that very much. And you can think about that right now. You can just move your knee around and recognize it's pretty hard to rotate the knee, right? Now, the reason I explain what the knee is designed to do is because that leads us down the next path, which is what goes wrong with the knee. And we're going to look at that knee's ability to turn in and out. Remember, it only rotates 5 degrees. But it's important to recognize that the knee is 2 bones that come together. So it is the femur, which comes from the hip, and it's also the lower leg bone called the tibia, which comes from the foot and ankle. Now, it's important to recognize they can't move, they have to move together. They are interconnected. So what the lower leg bone does, the upper leg bone has to do. And that's going to be really relevant here as I describe to you when we are looking for a solution to the knee pain. We also have to recognize and be aware that the foot and ankle influence the knee, make the knee move, as well as the hip. The hip joint as well has to influence the knee. So if I've got somebody struggling with knee pain, I'm always going to look and assess how well the foot and ankle is moving and how well the hip is moving. I like to use a phrase that describes the knee as stuck in the middle with nowhere to go. It's stuck in the middle of the foot and ankle and the hip. So later in the show, we're going to talk about what goes wrong with the knee, the hip, and the foot. So hopefully you can come up with a solution naturally and avoid medications, injections, and surgery. So we'll be back in just a minute, so stay tuned. We'll be back. Do your knees hurt when you walk or stand for a long period of time? Have you been told that you are bone on bone and surgery is the only answer? If so, I have a special event I want to invite you to. It's called the free How to Avoid a Knee Replacement workshop that I'm hosting right here in Traverse City, Michigan. Hi, my name is Dr. Andrew Gorecki, physical therapist and knee pain specialist. I'm going to teach you the exact process I've used to help thousands of people avoid a knee replacement. There are only 30 seats available for this free event, so call now to reserve your seat. Welcome back to Pain-Free Living. Again, Dr. Andrew Gorecki, physical therapist, owner of Superior Physical Therapy. And reminder, today we're talking about knee pain, and I'm trying to help you come up with a natural solution so you can avoid medications, injections, and surgery, and allow your body to do what it was born to do, which is heal itself. That's important. That's an important idea there. The body is designed to heal itself naturally, but you have to create the right environment. The right environment needs to include sleep, nutrition, and also the physical environment. The physical environment needs to be healthy so that it's not damaging the knee constantly. So really that's what we're talking about today, is the physical environment. So in this segment, I want to kind of hit quickly on the 2 most common names or diagnoses of knee pain so that you can kind of understand and maybe put yourself in one of those categories. By far, the 2 most common names are, number 1 is osteoarthritis, okay? Arthritis, maybe it also has names called joint space narrowing or joint degeneration, cartilage wearing out, bone on bone is one I hear a lot. And really, what does that mean? So arthritis of the knee or the joints and the bones, it's really a natural aging process. And in the next segment, we're actually going to talk about 2 studies, one particularly that basically shows that it's pretty hard to find anybody over the age of 50 without arthritis in their knee. Now the question is whether or not they have pain. I don't want to ruin it for us too early here, but stay tuned to the next segment. But really, arthritis is essentially the aging of the bone. So think of your skin, right? Your skin at 25 and then your skin at 75, right? The skin changes, it becomes a little bit wrinkly, maybe not so thick, a little bit more sensitive. And the idea is the same things are happening with our bones. And so it's important to recognize that it is really natural aging. The bone changes, the joint space does narrow. The joint space narrows in all of our joints, by the way, as we age. It's the reason why we shrink, most commonly in the spine. Our spine is actually losing joint space in the disc area. And so it's happening all over our body. But by far the most common diagnosis of knee pain is arthritis. Now we'll get to that in a minute. Later on, what do we do about it, right? Can you live without arthritis pain? Yes, you can. And now the second most common name or diagnosis of knee pain is what's called a meniscus tear. And as you can see in this image here, a meniscus is this little, as the bones come together to create that joint space, a meniscus is this little, almost like a cartilage ring that goes around the knee joint. And really the point of the meniscus is to make it so that the knee joint itself is more congruent or maybe more stable, so that the knee joint is maybe held together better. Some people like to refer to the meniscus as a shock absorber. I would say that there's not a lot of evidence to support that. In fact, there's a lot of evidence to support that the knee joints themselves or the bones aren't actually touching. There's space in between those bones, and that's a good thing. There isn't a structure on the earth that can be slammed into each other 10,000 times a day like you do when you're walking with about 1,000 pounds of force that wouldn't be completely destroyed. So our bones don't touch, there's a space in between, and it's our muscles and our soft tissues' job to keep that joint space open and transmit the energy elsewhere. So you've got two types, osteoarthritis and a meniscus tear. Now, again, next segment we're going to talk about the meniscus tear and does that equal pain? And there's different grades of meniscus tears, and I can say that it's natural for us to have some minor tearing. On the other end of the spectrum, we can have a meniscus tear that's so bad that it actually gets inside the joint and stops the knee from moving, where it locks up. In those cases, that is definitely a surgical situation where the knee is locked up and cannot move. For everybody else, there's a lot of hope. So we're going to dive deep in the next segment to discussing what really goes wrong that is actually causing the knee pain. Because we know that the osteoarthritis and the meniscus tear actually are not the reason why we have pain. They're just diagnoses that we find on an image. So that's an important thing, and we'll get to that next when we talk about the studies. And so if you're looking for a natural solution to knee pain, I would encourage you to give us a call at Superior Physical Therapy. We have knee pain experts waiting to speak with you. Simply call 231-421-9300 and we will set up a consultation. In the next segment, we're going to talk about what goes wrong, what's causing your pain. So stay tuned. We'll be back right after this.
I had to come back because of a bad knee. It was amazing, the tools he gave me. Then I had to have my knee replaced, and Andrew took me through all of that. The thing I appreciate most about Superior is, one, they don't look at the problem, they look at all of you. And I think that is important. Number two, they give you tools. I now have videos on my smartphone that I open up every day and I can do those exercises. I don't have to remember. I don't have a printed out sheet with drawings and lines scribbled all over. I have a video where a professional is doing it, or I'm doing it with them talking in the background, correcting my stance. I think that's what's important about Superior, is you just won't believe the difference.
Welcome back to Pain-Free Living. Again, my name is Dr. Andrew Gorecki, physical therapist, owner of Superior Physical Therapy, and today we're talking about how to find a natural solution to knee pain. You just learned about the two most common types, which are osteoarthritis and meniscus tears, and now I want to kind of talk to you about how those are probably not the cause of your pain. And so let's start out with the studies that I have. I have two studies that look at both of those conditions. So osteoarthritis, first of all, we have a study that was called a asymptomatic imaging study, which means that they looked at thousands of people that are having no knee pain, and they gave them an MRI for their knee, and what they found was pretty fascinating. 76% of people over the age of 63 have evidence of osteoarthritis in their knees in the study, but only 13% of those people reported having pain. So what does that mean? Well, that you have to come to the conclusion then that osteoarthritis is not a direct correlation or causation or cause of pain. And so we're going to get to what the causes are in a second. Now, a second study looking at meniscus tears was a systematic review and published by the British Medical Journal. And what they came to the conclusion is that they looked at people that had surgery for their meniscus, an arthroscopic surgery for the meniscus, and then people that went through physical therapy. And what they found was that there was no difference between the two groups. So the recommendation after reading that study from the BMJ, or the British Medical Journal, in 2017 is that people should not have surgery for a meniscus tear. They should go to physical therapy. You can find all these studies published on our website, and so if you want to go check that out at thesuperiortherapy.com, you're more than welcome to read all you want. I love reading studies because they help us understand better what's changing in the world of medicine, particularly in this case. So really that leads us to the next question of, okay, if I have arthritis or if I have a meniscus tear, which basically gives us 90% of the people out there dealing with knee pain, what's the real cause of my pain? If these studies indicate that it's not those two things. So let's dive deep into what causes knee pain. Remember earlier I talked about how the knee is stuck in the middle with nowhere to go. It's stuck in the middle of the foot and the hip, okay? So the motion that the foot and ankle does affects the knee, and the motion that the hip does affects the knee. And essentially the knee is stuck between the two. And so what happens? Well, let's use that rotation, that turning in and out. Remember, the knee only does 5 degrees of that. It hates to do it. Well, the problem with that is, let's just go and use that example for a second. When we know that when we're walking and our foot hits the ground, that the foot flattens out like a pancake. Most of you would recognize, yeah, my foot flattens out when I move. Especially when you do things like bending and squatting, the foot flattens out like a pancake. That's normal, by the way. When that happens, however, when the foot flattens out, it grabs onto the lower leg bone and it turns the lower leg bone in 30 degrees. You can see that in this image. The foot flattens out, it grabs the lower leg bone and it turns it inward, 30 degrees. Now, that lower leg bone goes up to the knee and says to the knee, hey knee, you got to turn in 30 degrees. And the knee says, wait a minute, I can only do 5 degrees. But good thing I've got the hip upstairs and I can grab onto the femur and tell the femur to turn in. The hip is designed to move in 60 degrees. So now that's a good thing for the knee. And now that's a scenario where everybody's doing what they're supposed to do. Now it's really common for us in the sitting culture that we're in, sitting for 10 hours a day on average, that the hips start to get a little stiff. Now imagine if the hip doesn't turn in and the foot hits the ground, flattens out like a pancake, grabs onto the lower leg bone, turns the lower leg bone in, and the knee says, well, I can only do 5 degrees of that, 30 degrees. Hip, can you turn in? And the hip says no. Now you've got a knee that's forced to rotate more than it's designed to rotate. And that is a classic example of how the knee can be painful, right? The knee can be painful, but the real cause is actually because the hip is not moving properly. So that is a classic example. Now, what I tell people that are dealing with knee pain, well, and let's back up for a second. If you're in that scenario and your knee's hurting you, the first thing you're going to do is go to the doctor and ask to get help, right? And what commonly happens is we get an image, an x-ray or an MRI that then tells us we have arthritis. And that can be very misleading because we first need to look at the foot and ankle and the hip to see if they're helping out the knee. And that is the recommendation that I have for you. Get your foot and your hip looked at first before you go down the path of picking on the knee. It's usually not the knee's fault. Remember, the knee is stuck in the middle. It's stuck in the middle with nowhere to go. It's stuck in the middle with the hip and the foot. So if my foot and my hip are not moving properly, my knee is going to get ground up and it's going to cause pain. Remember, the cause is not the same as the type. The type is arthritis or meniscus tears most commonly, but we know that studies show those are not equivalent to pain. The pain happens because the knee gets ground up because it's stuck in the middle. It's like a knee sandwich between the hip and the foot. I'm going to show you real quick, easy strategies to improve motion in the 2 most common problems that affect the foot and the hip. Let's start with the foot. I'm going to stretch my calf muscle. That's the most common muscle that gets limited in the foot and ankle. I'm going to put my hands up on the wall. This is the focus back here. We're going to get a nice stretch in the back of that calf. I want a foot that's flat and straight. I want a knee that's straight. put my hands on the wall, and I'm gonna gently let my hips move front to back, 30 seconds, then side to side for 30 seconds with my hips, and then rotate left and right with my hips. I'm gonna do that on both sides. Then, I'm gonna use this chair to work on the most common problem in my hips that causes knee pain, tightness in the inner thigh. That happens from sitting a lot. We're gonna use this chair. One foot's facing you, one foot's facing the chair. I'm gonna stay nice and tall. I'm gonna hold on to something. I don't wanna be risking my fall or my balance with bad balance. So hold on to a stairway. Maybe you're in a stairway or in a doorway. I'm gonna 90-degree angle my feet. My knee is straight. I'm gonna drive my hips towards the chair for about 30 seconds. Right away, I feel a nice, gentle stretch in the inside groin. 30 seconds towards the chair, then 15 seconds around counterclockwise, and then 15 seconds clockwise. I would then try the other side for another minute, a couple times a day, a couple weeks. I should start to notice some natural knee pain relief. Hope you enjoy. Do your knees hurt when you walk or stand for a long period of time? Have you been told that you are bone on bone and surgery is the only answer? If so, I have a special event I want to invite you to. It's called the free How to Avoid a Knee Replacement Workshop I'm hosting right here in Traverse City, Michigan. Hi, my name is Dr. Andrew Gorecki, physical therapist and knee pain specialist. I'm going to teach you the exact process I've used to help thousands of people avoid a knee replacement. There are only 30 seats available for this free event, so call now to reserve your seat.
I had to come back because of a bad knee. They don't look at the problem, they look at all of you. They give you tools. I now have videos on my smartphone that I open up every day and I can do those exercises.
If you're out there struggling with knee pain and you're not sure what to do, or maybe you think you've tried everything, I have something special I want to give you for free. It's called the Consumer's Awareness Guide to Knee Pain Relief. It's a guide that I created just for you if you're suffering with knee pain. So give us a call, 231-357-3930, and I will send you totally free, including shipping, the free Consumer's Awareness Guide to Knee Pain Relief today. Welcome back to Pain-Free Living. My name is Dr. Andrew Gorecki, and we're at the conclusion of today's show on knee pain. I want to summarize and recap what we've learned today. So you're smarter now than you were a half hour ago, which is pretty cool, and it makes me excited to help people heal naturally. So you know that the two most common types of knee pain are osteoarthritis and meniscus tears. You know that the studies indicate that those are not the cause of pain because there's a lot of people that have them without pain. You know that the common causes of knee pain are actually from the areas above and below, the hip and the foot. And you also now learned a few quick tips from me, so you can hopefully start to get on the path of natural healing. So if you're out there struggling with knee pain, you're looking for a natural solution, don't wait. You don't have to suffer. Give us a call. At Superior Physical Therapy, we have knee pain experts waiting to help you. 231-421-9300. And stay tuned next week. We're going to be talking about more common painful issues that people are dealing with that's preventing them from living pain-free. So hopefully you enjoyed today's show as much as I enjoyed making it for you. I will see you next weekend.